This PowerPoint presentation is going to discuss the knee joint. In order to understand joints, we need to activate our previous knowledge of the skeletal system. It's a good idea to have an overview of the knee joint before we go into details. And the first thing we usually start with is what type of joint is the knee. The knee is modified hinge synovial joint. Well, it is synovial joint. This is something we know already, and we know what is hinge joint from the YouTube film that demonstrated to us the different types of joint movements. And now the question is, why modified? It is because the knee can do flexion and extension plus a little movement of medial and lateral rotation. Now, the knee joint is the largest joint in the body and the most complex. Why most complex? Because it has extra structures that are going to enable the knee joint to do its function. Now, the knee joint is in fact made of 3 joints, and all these 3 joints are within one capsule. And these joints are the lateral tibiofemoral joint and the medial tibiofemoral joint and a joint between the femur and patella. Now, the bones that make the knee joint is something you know already, and the bones are the 2 condyles of the femur, 2 condyles of the tibia, and the patella. Since it is a synovial joint, it must have a capsule, and the capsule of the knee joint is not completed around the joint. It is having a gap, especially posteriorly. We have learned from the beginning that whenever we talk about a joint, we should question how stable is this joint. And the knee joint is fairly stable. Now, why is it fairly stable? Because there are factors that are adding stability to this joint, and the most important factor is the presence of the cruciate ligaments. There are 2, and they, when you look at them from anterior, they look like a cross, plus the weight bearing. When the femur brings the weight of the body, it helps in stabilizing the femur on the tibia. And we have other ligaments and muscles. Muscles around the knee joints are strong, large muscles. But in the case of the knee, the shape of bones has no contribution to stability. The best example that we had about the factor of the shape of bones adding stability is that of the hip joint. Let us go to images. Now, in this view, we can see that the knee joint is made of lower end of the femur with its features, the tibia receiving the lower end of the femur, and the patella, a sesamoid bone present in a tendon of muscles. And if we look at this view where the knee is flexed, we have a good view of the two condyles of the femur, and here are the two condyles of the tibia receiving the two condyles of the femur. And in this view, the patella is sitting on the patellar surface of the lower end of the femur. Before we do anything, we need to address stability of the joints, and we know now what are the factors affecting the stability of the knee joint. And there are what is called collateral ligament. One is on the lateral side that extends between the lateral epicondyle of the femur to the head of the fibula. And then we have the medial collateral ligament extending from the lateral epicondyle of the femur to the lower part of the medial condyle of the tibia. These are called collateral ligaments, right and left. Then we come to the main stabilizing factor of the knee, and that is the cruciate ligaments. We have two cruciate ligaments. One is anterior cruciate ligament, and as you can notice here that it is coming from the anterior part of the tibia, the intercondylar area, going posteriorly and laterally to insert on the posterior surface of the lateral condyle of the femur. And in this view, we have a posterior look at the knee joint, and here we can see that this is the posterior cruciate ligament. It is arising from the posterior part of upper end of the tibia and going medially. So when the anterior cruciate ligament goes laterally and the posterior cruciate ligament goes medially, they cross each other, and that is why they are called cruciate ligaments. Let's go to images again. Now, in this view, which is a very close view of the lower end of the femur covered with hyaline cartilage, is touching the articular cartilage of the tibia, and you can see that there is a red shadow. Now, this hyaline cartilage or the articular cartilage is not having a perichondrium, therefore it is not going to be renewed. If it is damaged, then that's it. Now, in order to distribute the weight of the body coming down from the femur, and we need shock absorbers, we have extra structures which are called menisci, and the singular is a meniscus, and this is a semilunar articular cartilage. This is the lateral meniscus, and this is the medial meniscus. Now, the menisci, or each meniscus, is going to add a weight distributing system, and it makes the knee joint, especially the tibial part, a little bit deeper. And this is a simulation where